Good morning. My name is Michael Brad Bayless. I am the founder of Bayless Healthcare. In our didactic session today, we have Sophia, postdaughter, who will bring to us a very informative and enlightening process called mindfulness. This process of mindfulness allows us to look deeply within the therapeutic process and allows us to see beyond the obvious. Hopefully you will enjoy this most informative program brought to you by Sophia, postdaughter.
For those of you who don't know me, my name is Sophia, and I am a graduate student at Argosy and doing my practicum here. I've been like recently exposed to the concept of mindfulness. I was struggling to find a topic for my dissertation, and I was talking to one of our professors at school, and we were kind of brainstorming of what I wanted to do and mostly what he wanted me to do, you know. I guess wise professors do that. They manipulated to do research for them, you know. So, and we were talking about doing research on envy. And he was really interested in envy and thought that envy, and got me really interested in just a few minutes because he presented it as something that he thinks underlies all psychopathology. And not that I'm going to go into that in any detail, but then he said, well, you know, I've always been really interested in studying mindfulness and envy and thinking that those are like the same kind of or related concepts, but on like a different end of the spectrum. And that if you're high in mindfulness, you're low in envy and vice versa. And so that if we can really, you know, tackle mindfulness and train people in mindfulness, we cure psychopathology, you know, ideally. And then I started to do a little research and, you know, plan to do my proposal for my dissertation. And it was really, really tough to study these constructs together, and they're so different. And I found myself always, you know, planning one paper on mindfulness and one on envy, and I couldn't really relate those topics together. But as I study it better, I'm starting to think that now I can maybe go into doing that one day. But we decided that I would just focus on mindfulness. And as I started studying it, I found myself resisting it for some reason, and he introduced the topic, and first I was like, nah, I'm not really interested. I think it's something. He said, do you know what it is? And I said, yeah, I think it's something about just being here right now. And that's pretty much all I knew about it. And so he gave me a lot of, like a stack of papers. Said, go home, study it, and we'll talk in 2 weeks or so. And so I did, and I became interested. And the first thing that he really said to me that kind of eased my resistance a little bit was, you know, I think my resistance came from the meditation piece. That how could I go and study something for my dissertation that I had no experience with? I had never meditated, did some yoga, but I'd never done like a Vipassana meditation retreat for 10 days or something like that. And I really thought that I had to have like extensive meditation experience in order to write, you know, something intelligent about this, about this construct. But then he said, he was kind of, he wanted to do some research on it because he's been thinking that it's really been misconstrued in the way it's been implemented in Western psychology from the East, where it really originates. And he thought it's lost, you know, its meaning somewhere along the way, really. I mean, they've grasped some of it, but not like the whole and what really it is, what it means to be mindful. And he said it's really more about, it's not so much a skill that you practice in meditation, although that's, you know, one way to cultivate it, but it's really a way of being in the world, like a world view. And he said, I don't think you ever have to meditate 1 minute to become mindful. Wow, that is very interesting. And so I started doing my research, and we ended up just focusing on mindfulness, and we're actually focusing on making a questionnaire or a scale that measures mindfulness. based on there's that Eastern perspective where he believes mindfulness really originates, or it does originate from Buddhist psychology or philosophy or whatever you want to call Buddhism. And so it's been really interesting. And I've found that as I dive into it, I become increasingly more interested in the concept, and I find that it has started to guide my work, really. I've always sort of found I think I found my fit as a psychologist in training when I took a course in psychodynamic therapy, and I really found that to be, like speaking to me, and I found it easy to understand my patients and where they come from, and I just think that the theory was really well fitted for the way I thought, I was thinking about clients and stuff. But then when I do the research on mindfulness and really get to know the concept better, I really find that that really guides my work too. And those mindfulness and psychodynamic theory, I think, fit well together, as I really believe mindfulness fits with every kind of theory. It doesn't really matter where you come from in terms of theoretical orientation. So I printed out some slides. I don't know if you're interested, or you can just pick them up later or whatever you want to. And so I really wanted just to talk about mindfulness as it can inform psychotherapy without necessarily engaging your clients in extensive meditation retreat or having had that experience yourselves. So mindfulness is really about being fully present. So I had that right in the beginning. It's about being, in the moment. It's pretty much, I don't know if any of you watched the inauguration of President Obama yesterday. As he had done he's been inaugurated, is that how you refer to it? And he stepped up, and the ceremony had been over, and he was walking out of the arena where it took place. And he walked up the stairs, and then he stopped and paused, and he looked back, and they've been airing it on TV over and over again, and supposedly he's supposed to have said, I just want to take this in. I'm not going to experience this again. And he stopped, and he just kind of looked over. There was an enormous amount of people watching him, and so that's, he was being mindful at that moment. He knew exactly where he was, what he wanted out of the moment, and he was able to preserve it fully and enjoy it. So it's when we're fully mindful, it's we're not dwelling on the past, and we're not overly worried about the future, but we're able to just be that, just be in the moment, but let the moment or be guided by our past or even our future without having it interrupted too much. So it's really an opportunity to fully experience our lives and being fully conscious of what is going on. And it is much more a way of being in the world rather than a skill or a technique that you employ when you need it. Different researchers have defined mindfulness in a different way. I just put up some of the common ones. So John Kabat-Zinn is he's like a pioneer in mindfulness research in the West. And his definition has become sort of a prominent definition of the construct here in the West. And he says it's paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. Dr. Siegel defines it as opening oneself up to the flow of sense perceptions, emotions, and thought processes in each given moment while attempting to hold judgment in abeyance. And then Thich Nhat Hanh, who is a Buddhist and who has really sparked many people's interest in mindfulness, says it's keeping one consciousness alive to the present reality. And then Ruth Bayer has done a lot of lot of research, and she has actually implemented a scale, a measurement of mindfulness that's called the 5-facet measurement of mindfulness. Close that down.
Yeah.
As he says, it's the non-judgmental observation of the ongoing stream of internal and external stimuli as they arise. So the central objective is to increase one's capacity to experience oneself and whatever is going on around. And without attaching to any particular view, without categorizing your experiences according to what you've experienced in the past or what you think the future holds. It's just like being here. But I think the many different definitions, although they all have kind of the same taste to them, is because it's just difficult to define this construct. It's something that is more experiential. You have to experience it really to know what it is. And that's why we don't have any one definite definition of that construct yet. So mindfulness is not just about paying attention or being able to focus your attention on something without being distracted, because that non-attachment that I talked about earlier is really a key piece to being mindful. And so when we're mindful, we become able to just know what state we're in, like our inner state. And we're able to recognize it without resorting to judgments, adding in anything to it, attaching, grasping onto it and wanting to hold it or trying to change it in any way. We're just seeing things as they are. And this sounds really simple, but it's not always so simple, is it? And mindful people really become to know their emotional state in the moment that they're experiencing it, not like retrospectively like we so often do. Oh, I guess I was just really angry, that's why I did this. But they know that I am angry right now, and so I can respond differently. And I'll explain that a little bit better as we go on. So there's this researcher called Martin, and he talks about mindfulness as a common factor in all psychotherapy. And I can really relate to that. I think it's really the underlying motivation factor that drives what we do and what we strive to do, which is decrease our patients' pain and suffering. And not only that, but increase their state of well-being, so that not only are they free from suffering, but they're actually able to experience more positive emotions and just have a different view of life and have a different relationship with what they're experiencing. So he talks about mindfulness as a state of psychological freedom. And that freedom lies in our understanding of where we are each moment. And it really involves a disciplined, quiet mind. So it is a practice in some way. And that's why it's so connected to meditation, because meditation has been shown and proven to really cultivate this state or quality of consciousness. And according to him and several other researchers, mindfulness is really what brings about, or is our potential for bringing about change in psychotherapy for our clients. And it's really about we start questioning our habitual responses and all our preconceived ideas, and we become better aware of how we are always guided by those, and how our behavior is often driven by our habitual patterns of behaving. So there was this story I read once about a mother in India who asked her, she had 3 sons, and she asked one of her sons to go, she gave him like a bottle and said, please go to the market and buy some oil for this. And she gave him $10. And he went to the market and filled up the bottle that she had given him. And then he went on his way home walking, and he fell. He tripped over something on the way. And he fell, and half of the oil was lost. And he took the bottle home to his mom and said, Mom, I'm so sorry I lost half of the oil. You know, I am no good. You know, I didn't do what you asked me to do. And because now we only have half of it, and I don't know, you know, what we can do to fill it up. And she said, well, okay, it's fine. I'll ask your brother to go. And so another brother went to the market. Same thing happened. He filled up the bottle with oil, tripped on the way home, and brought his mother half a bottle of oil. And he said, hey, I tripped, but I was actually able to save half of it. Really good job. I did awesome, didn't I? So she sent the 3rd brother to the market. Same thing happened. He tripped also on the way home. Really clumsy brothers. And but he came home and said, Mom, I tripped. I lost half of the oil that I had bought for your money. Now I only have half. But I will go back to the market, and I know how I can work so I can gain those $5, and I can buy more oil and fill up the bottle. And so this is, you know, similar to, he was very mindful. The other brothers, they were not really so mindful. And this is what we see, I think, in our personal life as well as in our patients' life, that we tend to be either overly optimistic or overly pessimistic. And what that really is that we just don't see the world as it really is. So we have this inner world that is not, doesn't really relate to or is not exactly as the outer world is. And so there's this dissonance that develops. And we can either beat ourselves up for not being good enough, or we can just deny, you know, what's going on and overly develop this overly optimistic view of the world, which is not, in essence, any better than the overly negative view, because we want to experience the world as it is. And so without this mindfulness factor, we are more likely to react rather than respond to the situation. And so the 3rd brother was actually be able to respond, and he knew what to do to make things better, and he wanted to, it was more like a realistic view of the world. I think I've talked about all these. So this picture, I'm sure you've all seen this illusion. So, and this, in some way, illustrates the mechanism of mindfulness. So when you look at it, you either see the ways, the ways or the candle holder or whatever it is, or the 2 faces. And so each percept is seen at the exclusion of the other. So you can only see one, and then you have to focus on the other to see the other one. And so one becomes the dominant view, while the other is in the background. And the less dominant view can only become the focus of attention when we intentionally shift our viewing away from the initially dominant view. And this is really what mindfulness does. It allows us to shift our focus to see both the dominant and what lies in the background. And once we can hold both views, we can examine them and choose, and better choose between whatever is in our view. And so without it, we oftentimes become lost in just one perspective. So mindfulness really gives us another perspective of the world, and so that it opens up our field of perception so that we can choose more wisely. So the core elements of mindfulness have been defined as being attention, and it's that discerning, non-reactive, sustained or concentrated attention, but not just reflexive or superficial attention. And then intention is, and I'll talk more about that when we go into talking about the Buddhist concept of mindfulness or origins. But intention is either a wholesome or unwholesome way of responding to things. And knowing that, do my intentions benefit or harm me or others? And so that you can discern between those. And it really brings value to awareness. And then it's the attitude, which is really an important piece of mindfulness. And that attitude is really emphasized in the Buddhist origins of mindfulness. It's not just what you attend to, but it's how. It's what attitude you have. It's about being open, being curious about exploring whatever comes to consciousness, accepting whatever comes, and having that compassionate stance, both regarding yourself and others. And so some of the benefits of mindfulness are you're able to stabilize the mind, maintain your mind in an alert stance rather than at the two extremes of dull or agitated mind. So you're able to really focus on the experience. And your mind becomes more flexible. You can shift your mind, like in that visual illusion before. So you can shift your mind so that you can actually look at, okay, what's in my background, what is in my past experience, and how can I inform my present, knowing what happened in the past? How can I respond differently now? How can I, whatever, if you experience anxiety and you can recognize anxiety for anxiety, and and then you can stop. It's really about calming and stopping the process of awareness, I guess, or stopping awareness at that critical piece where you're able to do this. So you're able to think, last time I was anxious, I did this. I became really angry because I was really afraid, and I yelled at my husband. It was not because I hate him, it was just really because I was afraid or anxious. And so you can kind of take that knowledge and imply it or infer your present moment. And no, it wasn't really that wholesome. How can I respond more wholesomely? How can I respond in a way that benefits me and others around me? And this brings about increased self-awareness. And that's really, really what mindfulness does, is increase people's self-awareness, knowing those pattern behaviors that we so typically resort to. And by knowing those, we can respond differently. We can discern between what has been beneficial in the past, what is likely to be beneficial now. And that's how we come to respond rather than react. So there have been a lot of different, or few different mindfulness-based treatments that have been developed basically as a result of the Kabat-Zinn and Linehan and their interest and their research on mindfulness. And I'm not going to go into details about each, but the first one was the mindfulness-based stress reduction. I'm sure you've heard about all of these, developed by Kabat-Zinn, and he developed that out of, he was working with a lot of chronic pain patients and patients with a lot of stress-related conditions. And he found that doing mindfulness exercises benefited those patients greatly. And then Linehan's approach is a little bit different, but she doesn't really use as much of those intense meditation exercises. But like in the mindfulness-based stress reduction, he has a different sort of like short meditation exercises. Like he has mindful eating, he has the body scan meditation, like sitting and walking meditation, and so on. And they vary from being a few minutes up till like 45 or 50 minutes daily meditative practices. And then there's mindfulness-based cognitive therapy, which was developed for prevention and relapse of major depressive disorder. And they took cognitive therapy and altered it a little bit and added that mindfulness piece. So they focus on changing one's awareness and people's relationship to their thoughts. And then there's the acceptance and commitment therapy, which focuses really on acceptance, that acceptance piece. So accepting your negative internal experiences rather than denying them, like many people tend to do. So these treatments have sparked a lot of interest in research, and the research base for mindfulness-based treatments has grown enormously in the last 20 years and it keeps growing. So we have a lot of research that shows or support the benefits of mindfulness. So I'm not going to go into details about what the research says, but these are some of the benefits it has from the Kabat-Zinn work. Has really been beneficial for people with chronic pain and depression. It has really shown to be helpful for people to not relapse back into depression, so they really change the way they relate to their experiences when they do become depressed, and they're faster there's like a faster recovery phase. Anxiety, addiction, borderline personality disorders really comes from Linehan's work on DBT. Eating disorder, cancer patients, helping people to accept what's going on, like people with chronic illness, helping them accept their changed physical state and grieve, whatever they're losing. And interesting research on ADHD. It has shown that it really boosts attention and improves executive functioning, which is really lacking in kids with ADHD and people in general with ADHD. And there was also an interesting research on ADHD and parents, so parents of kids with ADHD. And they applied mindfulness to the parents. Didn't do anything with the kids at first, and they showed that the parents responded much better to their kids, because ADHD, as you all know, is a disorder that is a lot of difficulty with impulsivity and behaviors, and these kids tend to get a lot of negative feedback from their parents. And so changing that really positively affected the way they related to their kids. And so it has that circle going on. So the kids responded better to the parents, and so very interesting research. A lot of very interesting research out there on the benefits of mindfulness. So this is all in clinical, and then just overall, both for clinical and non-clinical populations, it reduces distress, enhances well-being. People become better to identify their emotions and regulate their emotions. And they become more calm, have more clarity, they see the world, or they have a different relationship with their experiences, everything they're experiencing, because of that acceptance piece, that knowledge of the nature of reality, which we will go more in detail a little bit later. Interesting research also on brain functioning. That's kind of the latest interesting research out there on mindfulness that can actually alter brain functioning. There's research that show that in Alzheimer's, for example, there's the thinning of the frontal cortex that happens in Alzheimer's, and it has the potential of slowing that process down and increasing thickness in parts of the brain that has to do with learning and memory and emotion regulation and concentration and so on. So hopefully we will see much more research on that in the future. So in these therapies, meditation is a huge piece. And all these therapies that we talked about and these research is basically meditation is how mindfulness is cultivated. And so they are, just to give you an example of a short mindfulness exercise is people are directed to focus on their breath. They're just told, sit down, in an upright position and just start breathing. And just focus on the breath, because we all have our breath with us at all times, so it's easy to just use that. And so people just are told, just close your eyes and focus on breathing. Just breathe in, breathe out. Notice how the breath, how it feels like on the tip of your nose, in your stomach, how your stomach raises or your chest raises, or just focus on that experience of breathing. And what people typically find is that they can do that for some seconds, but then their mind wanders off. And so they're directed, just allow your mind to wander off and then redirect it to your breath. And so it's basically like, for those of you who ever had to teach a puppy to sit, you call the puppy, you say, come here, puppy, and then you say, sit, 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 and the puppy won't sit. And so you push it on the back and you force it to sit. And the puppy sits for a second, if even that, and then it wanders off. And you allow it to wander off, and you don't become frustrated or angry or anything. You just allow the puppy to wander off a little bit. And then you just call it back. Puppy, come back here and sit. And so you repeat that continuously until the puppy is able to sit when you need it to sit and when you want it to sit, and it's able to sit for longer periods of time. So that's basically what an analogy for how you can train the mind to become mindful. Allow whatever comes into mind to enter the mind. Don't try to force it out, because, and this is called insight meditation, and there's another kind of meditation called concentration meditation. That I think, kind of meditation where people are shy away from or are afraid of. That I can't do that. I can't concentrate on one thing and block everything else out. And so I think that insight meditation is in a way more welcoming to people. They find it easier because it's more forgiving, so to speak. So you basically just allow whatever comes to mind, and you take maybe like a mental note of whatever goes on and enters your awareness. And then you just let it float by. Just let it go, like the skies, in the clouds in the sky. And focus your attention back to the breath. And so it's through that repeated circle that mindfulness develops and matures. So, and people are instructed to focus on 4 areas. So on their thoughts, whatever thoughts enter your awareness, I must be stupid to do this, I can't do this, I'm running late, yada, yada, yada. Whatever thoughts come up. And then on feelings, what are your feelings that are connected to your thoughts? What are you feeling right now, even without thinking? Are you happy? Are you angry? Are you sad? And then the behaviors. Do you respond with aggression or by withdrawing? And then the physiological changes. What's happening in your body? What are you experiencing in your body? Are you breathing deeply? Is your breath becoming more shallow? Is your heartbeat racing? Is there a weight in your stomach? Are you feeling nauseous? So people are instructed just to learn to absorb these 4 different areas of existence with no intention to change anything. Just allow you to feel whatever you're feeling, think whatever you're thinking, feel whatever you're feeling in your physical being. So by doing this, the idea is that if you do this repeatedly, you start noticing and seeing. It's like your perception opens up and becomes wider, and you start seeing, hey, there's nothing that's really static. Everything is in constant flux. Everything is constantly changing, and nothing is permanent. My feeling of being sad and missing someone right now is not permanent. It will go by, and it will go away. It may come back, but it's not going to stay there forever. And it's really like somebody knocking on your door, or somebody calling you up, these salespersons that if you don't answer the phone, they will continue to call until you answer. And so it's much better just to answer the phone and tell them, hey, listen to whatever they have to say, and, I'm not interested, or I'm really interested, or whatever, and then hang up, and you get rid of it. Instead of, hearing that phone ringing again and again and again and avoiding to really look into who's on the other side of the line. So it really breaks through our stereotypical perception and allows us to see things clearly. So a little bit about the history of mindfulness. It has been practiced over 25 centuries, so it's well established in the world. It originates in Eastern Buddhist tradition of insight meditation, vipassana. The Buddha, the story about mindfulness is one about the Buddha and how he became awakened or enlightened on his search for the end of suffering. And he really thought that, or spoke about mindfulness as a simple mental factor, but it's one that's usually absent. Or not developed or matured. So it's like our consciousness is in these stages, these 3 stages. And the first stage is where anything enters your awareness. And it's like these initial sensory pieces that enter your awareness. And if they're strong enough, you relate, or you start to concentrate on it, and you become aware and you attend to those. But usually it ends there, and we are guided by what we've experienced before, how we are, how I relate to my glass of champagne is really because I had a good glass of champagne before and it was ice cold, and that's how it's supposed to be. And so if I take a sip and it's warm, I don't really experience it as it is because it's supposed to be cold. I've had that before, and that's what I want. And so you become frustrated or disappointed or anything like that. And so it's really about fostering that or maturing that initial piece of awareness, and like slowing down and noticing what comes up without resorting to your preconceived ideas. And I feel I've repeated that, again and again and again, but sometimes we need repeating to learn. And Buddha said that suffering arises from the conditions of our mind, and these conditions that I've been talking about. But those can be altered, or they can be corrected if individuals accept and see the true nature of where we are and our reality. And he thought that everyone can experience this enlightenment, this end of suffering, if we open up our awareness. So the method involves deep inner work. It can be done with meditation, for sure, but it can also be done with just implementing the insights that Buddha has proposed. So it's really accessible to anyone, which makes the application of mindfulness so exciting. So the teachings of the Buddha are embedded in 4 ideas, which he set up as the 4 noble truths. And the aim of these ideas is to destroy negative habit patterns of the mind and reach liberation from suffering. And that suffering arises from misapprehension of the nature of reality. So his first truth is that suffering is a part of life. It's inevitable. We can never avoid it, so we better just accept it. We're always going to encounter something unpleasant. We're always going to be disappointed by something. We're always going to encounter illness or death or loss of any kind. Something pleasant's always going to end, and we're always going to experience something not pleasant. And so that's the first truth, that this is inevitable, this is part of our human condition. And the second noble truth is really having that inaccurate view of the world really comes from how we relate to the first truth. If we deny that, or if we try to deny it or repress it, we suffer. And so we tend to just default to what is pleasant and deny what's unpleasant. That's just how we are, how we're built up. And that causes suffering. And suffering is really attaching to the good things and clinging on to those and trying to change the negative ones or denying them. And so it's through that attachment that I don't want this good experience to end that creates suffering, because inevitably it will end. And if we accept that it will end and just take on whatever comes next and think, hey, maybe it will, I will feel like this again, we have a different relationship with it. It's not as hard when it comes to an end. And then the third truth is that we can end suffering. And that's really the motivation for change, which applies to how we work with our clients. So it's really that mental clarity that comes about with mindfulness that is the piece that ends suffering. So, and then he proposed a solution. So a path that's called the Eightfold Path, that is really the change that we need to do. And that path really brings us in accordance to the nature of reality. So yeah, that's just the human condition, the inevitability of suffering. So the Eightfold Path is proposed to be in 3 stages, and essentially these all kind of work together, but every single piece has to be practiced, and mindfulness is one of those stages, but it's really kind of comes into every single one. Without mindfulness, you can't really apply any of the others. So, and these 8, there's this like 3 stages of training that involve cultivation of 3 different qualities, and these qualities are wisdom, ethical behavior, and then the mental discipline. And so these are the steps. So the orange one is the wisdom piece. So it's having the right view. That's really understanding what the world is, how the world is, understanding the truth about the universality of suffering, and knowing that there is a path to extinction. And the right intentions is the second part of the wisdom quality. And that's really our intentions of living in a wholesome way in this world, and knowing how to discern between unwholesome and wholesome things. And then there is the ethical behavior, which is the blue one, which is the right speech, right action, and right livelihood. And it's really commitment to how you're going to be in this world, based on all these truths and the four noble truths. So speech is you abstain from lies, gossip, or using harsh and unwholesome language in any way. And so you intentionally use language in that way, in a way that brings about wholesome action. And then there's right action is avoid intentional harm to another living being, killing, stealing, unlawful sexual contact, or anything that brings about harm to another living being. And then there is right livelihood. It's about living legally, peacefully, and honestly in this world. And then there's the mental discipline, which is the purple. And that's right mindfulness, right concentration, and right efforts. And so the mindfulness is, of course, the capacity to be aware in the present moment, which ultimately then guides us to learn from the past and make wholesome actions in the present and the future. And then the concentration, which is essential to mindfulness, because you have to kind of quiet the mind. You have to be able to focus, and that's why we do this practice of focusing the mind to mature mindfulness. And then there's effort. So the effort to and the commitment to avoid unwholesome or evil things. So this is really what sets up this way of being in the world. So implementing all these steps into our everyday living and committing to them, to walking this path. And Buddha said that if you do that, you can extinct, you can diminish suffering. You can never avoid pain, but you can avoid suffering. So you can experience pain when you don't necessarily have to suffer. And that's really your relationship to what you're experiencing is so essential. And it changes, and that changes suffering or diminishes suffering. So the process of becoming mindful is essentially you can do it through formal practice, which is the meditation piece. So it's a systematic meditation practice. So you're instructed to try out for 5 minutes in the beginning, but it ultimately leads to 45, 50 minutes practice of meditation every day, which is great if we can get our clients to do that and if we can get them invested. But it's a lot of the times it's difficult to get our clients to do any kind of homework or even just apply what we're teaching them or talking about in the therapy session to the outside world. So informal practice is more that application of those things that I talked about in the Four Noble Truths and the Eightfold Path into your normal everyday life. And that can be done just by talking about it, just educating people about those things, that life is not permanent, that you can develop this intentional, open, accepting view of life. And you can do this, you can train yourself to apply this, whatever you're doing. If you're running, if you're walking, if you're eating, washing the dishes, whatever, you can use cues to remind you to be mindful in every moment, in every day. So how can we use this with our clients? How can we integrate this wisdom that the Buddha found into our Western psychotherapy, regardless of if you're using meditation or not? Because formal meditation may not always be the right thing to do. It may not apply to you as therapists. It may not interest our patients at all. And even if they will then later become interested in mindfulness, that's great if that happens. But that doesn't say that if they're not interested in the beginning and in your sessions, that you should shy away from using mindfulness or utilizing that as one of your tools in therapy. So, so the insights that the Buddha proposed can really be introduced to our clients. So, just to talk about few of these insights, impermanence and no self are keys. And impermanence is that piece that suffering arises out of the mistaken view that we think that things are permanent, or we want them to be permanent, and we strive to make them permanent, when in fact everything is always changing. So we can direct attention to the experience of emotions, and we can show our patients that what they're experiencing now is really not what they will necessarily be experiencing in the next moment. And it's through that experience of knowing and thinking about our emotions and thoughts in that way that we can bring about change. And it becomes easier to accept those emotions, those hard, difficult emotions, and tolerate them when we know that they will pass. They will rise and pass. That's just the nature of everything that goes on in this world. And not a lot of people have even given this a thought because they identify with whatever is going on right now. I'm happy right now. I'm just a happy, calm person. When I was driving over here, I thought I was late. It was so easy to become frustrated, angry, to even think to myself, oh, I should have, gone 10 minutes earlier. I should have taken another road or something. But that doesn't really say anything about me. It doesn't say that I'm a lazy person, in general, because I didn't wake up 10 minutes earlier this morning or, something like that. So it's really just not identifying with whatever we're thinking or experiencing or feeling in the moment. And Buddha believed that the whole notion of a self is inaccurate. And this is a piece that a lot of people struggle with, and I struggled with. What do you mean? Of course there's a self. We're taught that in school, that we have to know that self, and it's like a constant. And that's like the piece that we know, and everything else we do not know. And we have to become to know that piece very well so that we can, change everything else. But it's really not that. And he believed that that is just an illusion, that there's nothing that is a self. You don't act the same way in this situation as you will in the situation at 11 o'clock today. This whole thing that we're doing now is changing us, in some small way. We are different now than when we woke up this morning. And we're always changing. So this static self is an illusion and cause of much suffering, because we tend to cling and attach to this fixed sense of self, and it brings about pain and difficulties because it's not reality. So it becomes really liberating when people realize that they don't have to identify with their depression. They don't have to identify with their disability even. They are something bigger than that. They may be disabled, but that's not their person, their self. Or they may be depressed in the moment, but they're not a depressed person. That's not who they are. There's something bigger than that. And that becomes very, very liberating and freeing. So, and then there's this acceptance piece. And suffering arises when we resist what is happening and want things to be different. And it's not really what happens that causes suffering. It's not that there was heavy traffic this morning that got me frustrated in the car. It's how I related to it, how I related to the traffic. And so you can relate to your experience in a more open and curious way, and really just, be courageous enough to face whatever enters your reality. And then there's the responding versus reacting piece. And I think we've talked about that in some detail. It's about that letting go of these habitual reactivity, like this, all these preconceived ideas. And by doing that, you gather this clarity, this fresh view of, I'm just going to drink that glass of champagne and enjoy it as it is, not as I think it is. It really allows you to pick roses, and whenever somebody gives you a bucket of roses, you can just enjoy them without, maybe previously you got them when you were sick and you had that, conditioned response to getting roses. But now you got them you don't have to bring that to your present experience. So it's really about this pausing and breathing, allowing yourself to stand up there once you've been inaugurated as the president, and just viewing, looking at what is going on, what is in my awareness right now, and taking it in. And then there's curiosity, which I think is a very important piece to how we approach the world, how we approach clients, not the least. Being curious about what they are presenting in our awareness, and being willing to investigate it. If patients come present with sadness or depression, be curious about how is it for them. What does it mean to you to be sad? What does it mean to you to be afraid or angry? And what does it feel like? What are you feeling in your body? What thoughts are going on in your mind? And it's this continuous investigation and curiosity, wanting to know more. So we do not categorize experiences rapidly like we so often do. But we are more open to just experience them as they are without conceptualizing them into some boxes and then react according to that. So that way we can really uncover the layers of the emotions that our clients bring to us, and we can see what is beneath it, what's underlying that anger, what is underlying that boredom. And the interdependence that telling our clients and experiencing with our clients. I had a patient the other day who had this anxiety, almost like a panic attack in session. He'd never had that before. And he was striving to really intellectualize what was going on and telling me, I think it is because of yada, yada, yada. And I'm like, just tell me, just what is going on right now. So having that curiosity, investigate how he feels, how it is for him, because it's different for him than me. And then once he was able to slow down, talk about that, are you still experiencing that anxiety? How is it different now? And I remember he told me, it's like I'm wearing clothes now, but I was naked before. And I thought that was such an awesome way of explaining it. And it was, but he really, if you just bring that attention to it, what just did happen, and it's that experiential piece. Did you realize, did you feel that it went away? And you survived it. And you will likely have that experience again, but just knowing that it will go away. Well, and I'm really talking about the impermanence now. Well, anyways. And then this interdependence, which is that everything arises in a mutually interdependent web of cause and effect. So like I talked about impermanence when I was going to talk about interdependence, I got you to think about impermanence, even though you saw on the slide that it was interdependent. So everything that we do affects someone else. Our thoughts, emotions, behavior, right now informs what we do in the next moment. When I realized I was talking about impermanence, and the slide said interdependence, that realization prompted the way I then guided you on to talk about or listen to me talking about interdependence. So everything we're doing now is connected, and that really brings about a connection to other people, knowing that however I behave in session is going to affect my patients, knowing that however they act or talk or think or feel or sense affects me, and it fosters that connection between people, and that really fosters that compassionate attitude that both towards yourself and towards others. So it's and it's like when we get, for example, if we have a patient who complains about her marriage, and my husband is cold, he withdraws, he's not responsive, we never do the things we did before, and I'm frustrated, I'm lonely, and all that. If you get, and we do that all the time, I think we get our patients to think, how can you change the way you behave to affect him and his responding? And because you have now become cold and withdrawn because he is cold and withdrawn, or you experience him as cold and withdrawn. If you intentionally bring more warmth into the relationship, that's going to affect him. So everything is connected. And then there's the innate goodness, that notion that all beings are born with a pure and noble essence. That knowledge, that wisdom, and we approach the world from that view. I think that brings about a lot of change. And for others and for ourselves, like judging yourself less, not being engaging in that self-accusation all the time. And that, again, cultivates also compassion towards yourself and then others as well. So mindfulness can really be applied to, it can be thought of as that common factor of therapy. And it can be applied, I don't think there are any limits to how you apply mindfulness. It can be applied for any age group, for kids, adolescents, adults, anywhere in the world, all the time. And for us as therapists, I think it has a lot of important pieces to it too. I think we've all seen that and heard about that evenly suspended attention is really that piece of how we relate to our clients, how we attend to them. And if we're not connecting and if we're not attending to our clients and if we're not aware of what's going on in the moment, how can we be of any help? And And so mindfulness really fosters that, or teaches us to be more empathic, more warm, to give our clients more attention, helps us as therapists to be in touch with our inner life, our experiences, and that ultimately then benefits our clients. And we understand, it's that I know that, life is pain, life is this satisfying, and for me, and also for all others. And so, every experience is different. And I think that it really has a lot of impact on how we approach our clients. And if we can foster that mindful awareness within ourselves, I think that we approach clients differently and we benefit them more. That's really all I had. Yeah. Do you guys have any questions or comments or thoughts in this present moment? I printed out a few books that I just, if in case you're interested. These are books. These are all just books about mindfulness. I have a lot of references. If any of you are interested, you can contact me, and I can for sure direct you towards some articles or research or anything. And then I printed out like this mini mindfulness exercise if you are wondering how to apply it or interested. And it's easy to get a lot of these online too, but I wanted to give you something.
Questions, comments?
I liked your presentation. I think I learn about it a lot within classes and stuff, and I've never heard it from this perspective. It's always like medication or meditation, deep breathing, but I'm just starting to learn that it's just embrace the noises you hear outside that you don't normally pay attention to, and so I liked hearing it from this perspective.
Yeah, and I think it's really sad that that people have resistances like I had in the beginning when I heard mindfulness, and I thought that no, that's not something I want to do. I don't have time to engage in a lot of extensive meditation, and I really need to do that to be able to present it to my clients. But it's really that view, that worldview, that you can present to your clients, and it can really open up their, I think, experiences and their awareness, so that they have this broader or better quality of awareness. So,
as you're thinking about this, I would encourage you to think about it. The benefits to us as individuals is pretty clear. Okay, mindful of the fact that we're in a clinical setting, to think about this from two different perspectives. Mindfulness for you as a therapist, and mindfulness as a state of clarity for your clients. And the connections to me are so obvious, it's a little hard for me to know where to go. So let me give you just something concrete to work with. If you're applying mindfulness to the concept of diagnostics, what does that mean in terms of you making that decision? That some family, some individual has come into this clinic, and now you are speaking with them and trying to decide what it means that they're here. Okay. So how do you see mindfulness as being applicable right from the beginning in terms of diagnostics? You think about the concepts. Suspended judgment, openness to possibilities. How could you see that work for you in terms of clarity in making diagnostic decisions? This is where you stop being students, okay? Because this is about really moving to the practice. And each one of you are engaged in this act of diagnostics right now, okay? So, I'm not asking you to try to figure out what I want you to say. I'm asking you to tell me what you're thinking in terms of this concept of being mindful, and you making very important decisions about diagnostics that can literally affect and change people's lives. So let's hear what you're thinking.
It would be important not to go with an impulse to consider what you were first thinking, but then also consider different ideas besides that first thought you have to make sure that you're encompassing the whole.
Impulse is reaction. And the problem with reaction is that it's driven by you and not the client. I may have this impulse that I'm afraid, but maybe the person's not dangerous, but just appears scary to you. Maybe I have a sense of this being hopeless and beyond my ability. Well, maybe that comes from some insecurity in you. Okay? So if you are reacting right away, there isn't likely going to be any suspension of judgment and objective observation of possibilities. So one problem can be, or value, is not reacting quickly to your own insecurities or your own theoretical training. You just had a workshop on anxiety disorders. It's real fascinating how diagnostic decisions are very much influenced by the last workshop you were at. Okay.
I was just going to say that along those lines, with a lot of clients we see here, whether they're Altex or Magellan, they come in with these previous diagnoses. And they say, oh, I was diagnosed bipolar. And so your instant reaction is to start picking out the signs that link to bipolar, where if you kind of go with this mindset and use mindfulness, then along what Joseph was saying, you can kind of separate that from what they came in telling you and actually make an accurate diagnosis.
Whether it's research or clinical work, you're a participant observer, which means by definition you're affecting the situation. It's why there's double blinds in research. Because if I'm looking to see if anxiety is related to this, and I know that, then I will find the connection, as opposed to me knowing this and getting someone else to do the investigation, because they don't know what I'm looking for. So they're not looking to confirm the connection I suspect. They are just simply looking to see what's there. Okay. So
There was an interesting research done like years ago. I think it's really old research, and you may have heard about it. It's about being sane in an insane world. So there were these researchers that got admitted to a psych unit, and there was nothing wrong with them. They were completely sane, but they were instantly diagnosed as insane because the clinicians at the unit, they had these preconceived ideas that whoever comes here must be insane. And so this was real research. So it happens, I think, all the time that we automatically just jump to these preconceived ideas, this habit of responding or reacting. And we don't evaluate, so we're not curious enough, we don't investigate, we don't look at what's in front of us, but we decide, so we rapidly categorize people and experiences. I think that happens a lot. What happened in this research, I think that unfortunately and sadly happens a lot because we think we know, because we've seen this in the past.
I was working yesterday. I was at one of our nursing homes, and I went in, and I was supposed to see 3 clients, but one was really, really upset, having a really difficult time, and the staff had just decided she was non-compliant. So she wasn't going to take a bath or a shower, and she was sobbing, and she was having a really hard time. And I said to them, just give me a little bit of time. Let me just sit with her for a little while. And it came up that she has a lot of medical issues, and she's not overly stable. And when they went to put her into the shower, she almost slipped. And she can't get past that now. And so there's this huge amount of anxiety. She's got some open wounds all of a sudden, and because of that, her health is in jeopardy. So they're concerned about her medical well-being. She's concerned about if she's going to be safe or not. And she's having a hard time. So they went right away and decided she's non-compliant. Rather than putting some pieces together. So I spent an hour and a half with the staff brainstorming, how do we get her into the bath, if she's more comfortable in the bath versus the shower, as stable as she can be, so that we can take care of her medical needs and make sure that the wound's being taken care of and she's clean, etc. So I think even that's a little piece where we jump right away and we decide, boom, this person is a problem, rather than, you know, where do we go, what do we do, how can we look at the bigger picture to figure out how to support this lady who's in pain in all levels of her life. So I saw that yesterday. You know.
So the question for me is, as therapists, what do you think is most likely the greatest distraction to you being mindful in your therapy sessions for you?
Personal lives. I was just thinking when you were saying that about, you know, bringing it back to being self-regulated ourselves. If we're not, this whole mindful thing is not going to work if we're not able to keep ourselves in a place that's, we're able to pay attention. And, you know, a lot of times I think workers are overstimulated and have too much going on that they're like, she's just not being compliant, so we're going to do whatever, but they don't take the time to actually sit in the moment and see how we can help this person. But like I said, if we're not regulated ourselves, how on earth are we going to help someone else get regulated and be mindful?
And what do you think is the most prevalent thing that distracts you as therapists? Some of you who work with me may, if you think about it, you'll know, because I tease you about it all the time.
I get lost in the content of the session and all the little details rather than looking at the whole process and the bigger picture of what's going on.
Details and then our associations to the details.
Yeah.
Okay, that's a real common thing. Is not seeing the meaning of things. The whole idea of not seeing the forest for the tree, and thinking there's so much going on when there may be one simple thing going on. He's scared. Okay. Now, how that fear or anxiety presents itself can be in lots of words or no words at all. But losing what's going on right now, that this person has an experience that's very much driving how they are with us and vice versa. You're going to say something.
I get lost in the fix it. And instead of being present and mindful, and I think a lot of even our clients get lost in the fix it, and you know, they feel certain ways and society says that they shouldn't feel those ways, and so we get lost in the, it's almost like from the DDT, you want to validate those feelings that they're having in that present moment and just sit with that. And saying, I try to use a lot of mindfulness in my practice, and a lot of times, like you said, like be okay with silence and saying, let me sit with that for a minute. And let them sit with that and not try to just fix it in the moment, but just be with it.
So why are we so fixated on fixing it?
Because we're too focused on the outcome, like where we want to go.
The biggest distraction I see is assessing whether the session is good or bad.
Judging.
This is a good session. Oh, this is a bad situation. Or this client's really angry. She's coming in. And that's a bad thing. What am I going to do? She's angry. Okay. It's not going the way I want. Well, this is a great session. This is a bad session. Oh, remember the session last week was really good? Now it's really bad. Okay. It's that mindset of judging. And I tease you about you're thinking like a student. You're trying to grade your session. You're trying to grade the current interaction. Is this a good interaction or a bad interaction? Is this a good session? Every minute, second, you spend thinking about that, you're detached from what's going on and you can't do what you need to do. Okay. So keep that in mind. That's the biggest distraction to being mindful of what's going on in the moment, and that is judging whether or not what I'm doing right now is the right or wrong thing, or this is good or bad, or is this going to show up on the tape and I don't want my supervisor to see this, all those kinds of things. Okay. As opposed to just taking in what's happening and asking yourself to take it in and what does it mean? Not what do I do about it, how can I fix it? Those are natural conclusions to truly understanding what's going on. We often try to fix something and we don't know what's going on yet. With us or with the client. And that's going to really distract you from the clarity and simplicity, and which usually is. What's usually going on is very, very simple. There's not a whole lot going on. Even in the chaos, there's a simple truth. And the question is, can you get to that? Because that's where effective work is.
Nancy,
leave our egos aside.
Egos and competition. You know, and for those of you that are new, I already mentioned to you about that. If I see you competing, I'm going to point it out. One-upsmanship, okay? That let's see who's got the most borderline client. For those of you that don't know, that's Jennifer DeGraff. If you're interested in the Lighthouse Project, you need to be really nice to her because she's going to make the decision. Okay? Okay. I'll talk to you later.
Bye. Have a good day.
Okay. Okay. You can't do what you're doing if you're worried about what you're doing. The nice thing about supervision is then you can back up even further, because the context of supervision is looking at all of that too. But while you're in the room, you can't be thinking about your supervisors, your class, your didactic, your seminar. You can't be thinking about that. Am I any good at this? Okay. Am I in the right profession? Oh my God, why did I say that? Okay. Because if you said it, there's probably a reason for it, and you probably need to pay attention to it. You know, it becomes helpful in establishing clarity, unless you're striving to have the perfect session and be the perfect therapist. That's the distraction. The notion that there is a single one right thing to do in this moment. And if you really believe that, odds are desperately out of your, I guess, against you. Because in any moment, there's a billion things to do. And if you think there's only one, then that's a pretty hopeless proposition. That you can find that one right word, that one right sentence, that one right point. Because all the rest of them are wrong. So I'm not sure that's a good thing to put on yourselves. Other thoughts?
Something that's helped me is a lot of times in our some of the trauma stuff we do, one of the things we say is clients are going to have the experience they want to have or they need to have. And so knowing that helps me a lot to know that they're getting out of the session what they need. It's not about what I need or what I'm giving them. They're going to take from it what they need. And that is so helpful to me because I just feel like, you know, whatever I give, whether or not it's good or bad session, they get out of it what they want and need. So it's not about me, and that really helps me.
And this is where I tweak you all a little bit too about who's in the driver's seat. Because the session is about what the client needs. What happened in the session, all about you. What are you going to do with it? Okay. What are you going to do with it? That you're a partnership in this exploration, discovery, whatever you want to call it. You know, I keep saying you've invested, up to this point, 2 decades or thereabouts of education. To sit and do nothing in the session? There's an aspect of this, and I think there's an avoidance piece, an avoidance of the involvement. You're engaged. Whether you do nothing or something, it's something, okay, to the client. So don't be afraid of that. Embrace the fact that this is a very meaningful interaction, a potentially very powerful interaction of discovery and change. The whole purpose is for you to introduce a new element. Because I'm here because I can't find that for myself, in myself, by myself. So, you know, don't be afraid to be a catalyst. Don't be afraid. I'm again reminded of Mandela's speech, and Naglo's speech. Don't be afraid of your limitless power to influence the world. People are afraid of their power. They focus on their insecurities. Don't shy away from how powerful you are as human beings to be able to change the world. So you are an active part of this, okay? You know, embrace that. You've prepared yourself for it. You're ready for it. The only thing that gets in the way is the noise in your head. It's questioning. But you are an active ingredient of this process. There's no passivity here. So there's a balance of the two. They're not in competition with each other. The client is bringing a lot of active things, thoughts, feelings, insecurities, fears. You're bringing a lot of active things, including those things. as a fledgling therapist or a therapist who thinks that, you've never done this before, never interacted with a human being before? That's what you're trained to do, to be experts in understanding the dynamics, not to be experts in anybody's individual life. That will never happen. I can always make the case that you don't know me because you don't know where I'm from. Well, of course. But that's not even the point. The point is, I don't know me. And, we're here together so I can discover those pieces of self. I love that piece about no self, by the way. I like to tease psychologists about that. We think we're measuring personality, which doesn't exist. Okay? All that exists are habits that are so strong that make you very predictable given these tests. But at any given point, you can choose not to do that thing that the test predicts that you're going to do. But by embracing this idea of self, it becomes very easy to put a test together, predict exactly how you're going to be in the situation, because of the fear of what else could be there, who else I could be. At any point, I can be anything and anybody, and same for you. But in this situation, I don't go out to parties because it's not me. Well, no, it is you. It's you being afraid. Okay? And what would happen if you weren't? So what we're trying to do is to explore where the boundaries are that create fear, anxiety, uncertainty, and doubt in people, and to challenge those boundaries. What would happen if you stepped outside those boundaries? Okay. That's what you do as therapists. It's such a wonderful thing to be able to be involved in. Self-discovery. And promoting that discovery in someone else so they can figure out not how they can change, but how they can move past self-imposed limitations. I didn't think I could do this, shouldn't do this, I'm not able to do this. And I realized that's a self-imposed boundary of this thing I've created called myself. Okay.
Yeah, and we have this ideal, this image of it even, and that is the cause of a lot of
because you can never
criticism
compete with the ideal.
Never.
Okay.
Yeah. There's a good book if you guys are interested in reading anything about this called Psychotherapy Without a Self by Mark Epstein. It really puts this together in a good way.
One more time, the title, please.
Psychotherapy Without a Self. It's on that list.
It's on the list.
Yeah.
Thank you.
And I think what I really like about mindfulness is it's exactly not like just a relaxed mode of or a way to relax and enjoy the moment. It's a really active stance. It's a really intentional and commitment to act in a certain way and relate in a certain way. And I think that's...
Other thoughts, observations?
I like the piece where it's something that you practice throughout your day, every day, and not just for the hour that you set aside or the 30 minutes that you set aside, but really it becomes something that you incorporate into almost every moment. It just helps you stay grounded and focused.
And it is something that I think, as I said, a lot of us don't really have, or we haven't developed it. So it is like a maturation. And I think eventually, if you remind yourself, first it may be a bit foreign, and you have to remind yourself to think in this way and to act in this way and be mindful and all that. And then eventually it just becomes this way of being. And it's like that piece of consciousness has just matured and it has increased in quality. And so you're able to benefit from it and utilize it in every situation, all the time.
It's very freeing.
It is, yeah, liberating.
I've heard it defined like the old radio dial. So when you said let the mind wander and then come back, and it's that the more we can attune it to the station or the frequency we want, even though we have all the choices, it's kind of an advantage to.
Yeah, I also heard it defined by when you're taking a picture with a nice camera that has a lens that you can you can tune in and then tune out. And so that's kind of constantly what you're doing. So you're focusing in on something that you need to focus in on, but then you can focus out and you can see the whole landscape. And you can really respond because you have that wider view. So.
Any thoughts, questions, comments, applications?
I really like the interdependence part. I feel like in an interpersonal aspect, more of like, this is my anxiety or this is the client is looking for me because of their way of acting versus my way.
No, we're done. You just missed my presentation.
Oh, I did?
Yeah, you're late.
I'm so sorry. We do something about that light?
Yeah, let me try
You're
to
in the
shut
spotlight.
Trying to shut it off so you're not blinded by this, but
Do like I always do, unplug it.
Okay, the interdependence piece is so critical because again, it's something that I think can be missed in your sessions. That regardless of what you're talking about and discussing, there's an interaction occurring. And that itself has meaning that can be applicable to the work that you're doing. People tend to approach their sessions the way they approach life, and you'll see parallels. Whether it's how they handle fear, avoidance, pain, frustration, closeness, honesty, when deception comes into play, which reveals all their kind of myriad of patterns that sometimes I think doesn't get addressed. And what I've seen is that when you address those in your session, when you make a comment about how this person is relating to you in that moment, it tends to intensify things. And it's also much harder for me as a client to deny. You can make observations about what I said about my relationships out here, and we can work with that. But what you experience in the room yourself is a little harder for your client to distort or ignore. And looking for those things about why they didn't show up the next session, or why there's a change of demeanor or approach, or why somebody who was very vocal sometimes is all of a sudden silent, or vice versa. Why someone who was silent is now very vocal. And being able to comment on those as a way of moving your therapy forward into content that the client previously was hesitant to get into. Because there's a trust level. There's been a threshold that's been crossed that allows you to get into a territory that was locked, that they wouldn't open up before. And I think it's important to get to those places, because a lot of therapists, a lot of therapy can run the risk of being superficial. Where a person, and this is particularly true, we see this in my house all the time, where there's a scripted story that they've told you, and it feels like disclosure, but if you really watch, it's absent of a real level of emotionality. Even with things that are very traumatizing, they can tell you without emotion circumstances of physical and sexual abuse, of violence that they've observed, and sometimes it's not really therapy, it's an engagement strategy. I want to see what you do with it, how you react to it, and depending on that, maybe we'll get someplace, which is the reason why I'm here still, because all that stuff has been covered before, but here they are, still here. So something has not been covered. Something has not been addressed. Something is unresolved. And that's particularly true when people recycle. Okay. Something got missed. And we need to push a little harder sometimes. And the client will experience distress, which is not good or bad. It's just honest. Okay. So are you ready for the meditation?
For the who? I don't know everybody in here. There's
Well,
new
maybe,
faces in here.
yeah, there may be some people, there are some brand new faces back. Can we stop just a second? This is Dr. Brad Bayless, who actually is the founder of this thriving business now, from what your little one-person clinic and telephone and copier, okay, to a thriving multi-site behavioral health organization that's expanding in a climate where people are reducing. So it says something about two things. One that's well known. Dr. Bayless is a nationally renowned forensic psychologist. Okay, but he also has another talent that we've talked about that is lacking in most psychologists, and that he has a sharp business acumen. There's a reason why we're expanding. Okay, in a climate where other organizations are cutting back. Even in this current climate, we have laid off no one. And in fact, we're in the process of hiring 2 additional therapists right now who are being offered positions. And we're growing. We opened up a new clinic on the south side, and some of our clients, some of our people that we hired were people that were laid off and rifted from other places in the same organization. Lack of being mindful of what the climate is telling us in terms of where opportunities lie, and not being accepting of the current condition of how we can fund ourselves, and find alternative fundings that allows us to grow, remodel a new clinic, add in integrated health services and medical services and practices, to open up a new administrative clinic to be able to handle the infrastructure, and to pursue contracts outside what many of our competitors are providing. And we've only just begun. And you know that, right? Okay. You know, you ain't seen nothing yet. Okay, this year.
We're poised to make a fairly large explosion,
Yes.
probably within the next 6 to 9 months.
Yeah.
We should probably, hopefully, if everything goes as we're planned, we'll probably double to triple in size.
Yep. In this next year.
Yeah. So it's going to be a good deal. But I don't take all the credit for that. John has been with me for a long time.
But I've known him for a long time, so I can tell him be quiet, even though it's his business. Because here's what I also know. It's true. That as a businessman, as a psychologist, he's the best businessman I know, and one of the few I can talk to, because this is something you're not taught. You know, when most of you are going to have to be involved in either running a business or part of a business, and you need to know the finances of it. Okay, but what I also know is, in spite of your reputation as a psychologist and his expertise in negotiated business, he's got 2 kids, and his proudest thing I know is being a dad to those kids, who have reached the top of both of their fields. Ironically, one of them now the president of this company, and the other one, the peak of his field, as high as you can get as a basketball player in the NBA. Now that's about diversity and excellence. Okay. So, and I know the proudest award he's got is his Father of the Year award.
That's right. Oh, I know. That's what I go.
So maybe we can do is if you could, each one of you just really quick stand up and let them know your name and who you are and what program you're associated with, so we can get to know some faces real quick. So
I know Chester over there. She doesn't have to stand up.
Yeah.
No, Sarah, you've been with us what? 5?
I started my internship in 08.
Yeah.
Former intern,
So
now senior clinical supervisor.
yeah. So she, Sarah's one of my more favorite people. I tease her more than anybody else around here. So, and whenever I get the opportunity, I always get on her nerves. But she's a person who's really special to us, and has been just super in her dedication to the company and in dedication to her clients. I'm really proud of Sarah.
Yeah.
Thank you.
Yeah, absolutely.
Were you in the moment?
Yeah. But we have a lot of new interns.
And let me also.
These are mostly new folks.
Yeah, I know. But I also want to recognize Susie too,
Yeah.
because Susie has been with us for quite a while also, and you came on
9 years ago.
9 years ago, yeah. So
What is that? 9?
that tells you something right there in terms of us maintaining our people and everything, and I think she's probably one of the best social workers around. personally.
I'm honored. Thank
Absolutely.
you.
And
No doubt
and sometimes
about it.
people don't need. You need to hear that sometimes. I think that we kid around a lot and we joke a lot and everything else, but. And I'm that kind of person, by the way, you guys. You know, if I like you, I'll joke with you.
If he doesn't, you
If
might
I don't
wanna
joke with
take a
you,
look. Be mindful of
yeah,
that.
well, okay. So, you know, Susie and Sarah have been, are two special therapists. You guys can learn a lot from them. And has been out there in the field for a long time. So a lot of times they may tell you things that you say, I don't know if I really agree with that or not. Take their word for it. These girls are seasoned people, and they know what they're talking about. So, you know, they're special people. Yeah. Who's this
Some
gentleman
quick
here?
introductions.
I'm Joseph. I'm from Ottawa in the trauma program, master level.
Okay, great.
Great. Work your way around.
I'm Haley Evans. I'm from ASU.
Okay.
I'm Michaela Durfee. I met you briefly like 2 weeks ago.
Yeah.
I stole Sarah. You guys were
Away
supposed
from
to go
you.
to lunch.
Oh yeah, I remember that. I remember. Yeah.
ASU master's student.
Yeah. Okay.
I'm Nick Martinez. I'm a master's student at ASU.
Okay. Cool. Well, I know Shelley. Okay.
Jessica from ASU, the Masters of Counseling.
Okay.
Okay.
Where do you have that baby, girl?
Okay.
You know,
Staying
every time I see you, you're sitting with your hands on your stomach and it's getting like, you know.
When it turns 18, it'll come out.
Wouldn't that be
That's
wonderful?
the ideal prevention program. Okay, cool.
Yeah, you're about ready though, aren't you?
A month or so.
Yeah, we got you for about another month, right?
Yeah.
Don't go into labor here.
I think my clients are more worried about my water breaking on their couch than anything.
Well, this may not be a bad place for you to go into labor. Now we
Now we got primary care, right?
Hook you up. You know.
Stirrups available.
There you
Yeah,
go.
there you go.
Okay. Yeah, we can handle
That would truly,
that be?
that'd be a truly Bayless baby there for sure.
Yeah.
That's for sure. Who else in there? That young lady, I met you before.
Daniela, yeah.
Thank
she's,
you,
Yeah.
Daniela.
Yeah. You're a doctor's student, right?
I'm a doctor's student
Yeah.
at RDC University in clinical
Okay.
psychology.
Yeah,
I'm at
cool.
South of that.
Yeah. I met you before.
Yeah.
Yes.
Doctoral student too.
You're a doctor's student.
Yeah.
Okay. And I know you. Trouble over there, okay? Yeah.
Okay.
I'm glad to have you guys, and
It's a great group, by the way.
it's yeah.
This is
They,
really
you know, I hear nothing but good things about everybody. Actually, I haven't heard any negatives whatsoever, and and hopefully I won't hear too much about you as I start my travels here. You know. As soon as this intern, as soon as
You're
this,
stuck.
I know, yeah, I know.
You're not going anywhere.
As soon as the supervision thing is over with, man, I'm out of here.
Yeah,
You
you
know.
keep getting hooked in. It's like Godfather.
Oh yeah, I'm gone. You know,
Yeah, we'll see.
I'm good. See,
I
Don't
said-
make
I
any
said
travel
that
plans,
too.
you know.
yeah, all right.
Okay, thanks. Okay. Well,
So, thank you for choosing Bayless, and hopefully your experience here will be something that is very enlightening and at the same time very educational for you, and that you can carry on. And whether you stay with Bayless or whether or not you go out there in the field or whatever you may do, you know, I want you to be successful, because you still will carry our name. You say, where'd you do your internship? Well, Bayless. Oh, no wonder. So we want that response to be very positive. So it's very good.
great, thanks. Great presentation.
Yeah,
Lots of
you did a
applications.
nice job.
Lots of applications. Yeah, lots of
Was your presentation?
Yeah.
Oh, man.